And kind of tagging on to my previous post about medications, ADHD interactions, depletions, things like that, I wanted to go over a few notes and research articles that I found on herbs and if they were actually worth a shit on helping with ADHD. So there was a double-blind randomized control trial, which we know that is the best kind. That was in 2010, and it showed that ginkgo biloba, improves cerebral blood flow, antioxidant effects, and possible modulation of dopamine and norepinephrine. Because we know when we're looking at how these are converted, dopamine's converted to norepinephrine and epinephrine. So it showed that 240 milligrams of the ginkgo extract improved hyperactivity and attention compared to the placebo. So effect sizes are smaller than stimulants, but there's some benefit in adjunct therapy. So it works better when combined with conventional treatment than just on its own. But if you are not taking any ADHD medication and you want to try the herbal route first, you can try with these. Again, talk to your doctor, make sure there's no other nutrient drug interactions with this. This is just what I was flipping through PMC and finding. So the picogenol, which is pine bark extract, my pine bark journey. I was cutting pine needles off a tree and steeping it. And it's actually really good. Like, that's a really good tea. But anyway, so antioxidant, anti-inflammatory, modulates the catecholamine metabolism with dopamine. So there was a randomized control trial in 2001, another in 2006, showed improvement in attention, hyperactivity, oxidative stress markers in children after 4 weeks. A lot of these RTCs, randomized control trials, are on kids because that's when it should be diagnosed, not late diagnosed ADHD. But here we are as women. So symptoms returned after stopping the pine bark extract, so ongoing use. Bacopa is something that I take. It supports memory, learning, synaptic communication, and may modulate acetylcholine and dopamine, which acetylcholine, give me on that one. So there was a randomized control trial in 2006 and also one in 2015, showed significant improvements in attention, cognition, and impulse control after 12 weeks of use. And this really, Bacopa takes weeks. It's not something that's PRN. It's something that you have to continuously take. I recently started back on taking saffron. So saffron increases dopamine and serotonin activity, also antioxidant effect. There has been multiple randomized control trials, 2019, 2010, 2015, 2006, in children and adolescents, found that saffron extract is to be as effective as methylphenidate or the Concerta over 6 to 8 weeks for core ADHD symptoms. So this also works in adjunct to the stimulants to improve the residual symptoms. Normal dose on saffron is usually about 30 milligrams. And saffron is very, very expensive, so don't be getting the ones that are just filled with fillers and binders and all the other shit. Panax ginseng. Now, a lot of these, like the Panax ginseng, the ginkgo, I know that there's nutrient drug interactions on this, so you have to be careful with these. May enhance dopamine and norepinephrine signaling, so this is adaptogenic effect on stress response, so adaptogen. There's RTC 2011, actually 2 in 2011, with children with ADHD showed improvements in attention and some executive function measures after 8 weeks. And we all know the executive function issue with ADHD. Omega-3s, it's not an herb, but worth mentioning, that it improves the neural membrane fluidity and modulates the neurotransmission. So there was a meta-analysis that showed modest but significant in attention and hyperactivity in those with baseline low omega-3 levels, especially EPA. Interestingly enough, because DHA usually is touted for brain health. But also I want to say that if you are a fish eater, eating cod, salmon, tuna, sardines, anchovies, etc. 2 to 3 times a week can be as efficient of taking a supplement every day, because omega-3 supplements are sus, super, super sus. There's so many trials done on those that they don't even have the right amount of EPA and DHA in them, and they're just filled with all kinds of different oils in there. So I'm very reluctant and have to really look at those omega-3 supplements. But you can also, there's a lot of studies on omega-3s with depression as well. So really the top ones, the strongest randomized control trial evidence is going to be the saffron and the pine bark extract. So usually you have to take at least 4 to 12 weeks. It's not something that's going to happen instantly, but with that, you know, you can take a lot of these with adjunct to kind of help. But again, not a doctor. Talk to your doctor first. This is just my digging down the rabbit hole on what can be beneficial if you're not taking those, or if you are taking certain ADHD medications. In the last video, I talked about the benefits of making sure that your B6 is in check, your magnesium, iron, calcium, vitamin C, and with certain, especially CoQ10 as well. I would throw CoQ10 in there just for mitochondrial health. Even a low dose CoQ10. And then we can get into NAD plus and all the other things that are going to help with mitochondrial function. But that's a whole different thing. So yeah, there you go.